So my name is Jonathan Riboh. I'm an orthopedic surgeon and sports medicine specialist at Duke University. This study was done jointly between Duke University and with the partnership of the Biomechanics Lab at Arthrex in Naples, Florida. So ACL reconstruction with patellar tendon graft is something that we've done well for many years, but as we've transitioned to lower, more anatomic tunnels on the femur, there are some challenges with fixation on the femoral side. One, it can be hard to get the angle for an interference screw into the tunnel, and more often we can actually have length issues where the graft is long and protruding on the tibial side, and it might be difficult to correct for that length on the femoral side. So our clinical practice was to use suspensory adjustable length fixation on the femur, but we didn't know whether it was equivalent to the gold standard interference screw, so we set out to do a biomechanical study to answer the question, is an adjustable length loop or suspensory fixation equivalent to an interference screw for a patellar tendon graft? So we conducted a controlled laboratory study. We used porcine femurs and human patellar tendon allografts to do this study. We really had four main findings. The first was that the load to failure was the same between an interference screw and an adjustable length cortical fixation device. Our second finding was that the stiffness, which may even be one of the most important variables, was the same between the two study groups. Stiffness is really related to what as surgeons we think of as the Ligament test, or how tight the knee feels, so it's important for that to be the same. We did find that the fixation with a loop afforded a little bit more cyclic displacement than with an interference screw, but that difference was less than 1 millimeter, so that may not have major clinical relevance. And the final finding was that the mode of failure between the two fixation options is different. When you fix a bone block with a screw, it typically fails by slippage of the block on the screw. In the suspensory fixation device group, we noticed that the bone block actually would fracture through the drill hole, and essentially the suture of the loop would act like a cheese wire and fracture the bone plug. And the clinical corollary to that is if you're going to use this device in an allograft situation or with poor bone quality, we think that one needs to be particularly careful with these devices since it's quite easy to rip through those bone blocks. In terms of what comes next, clearly we need to figure out whether our findings are clinically meaningful and relevant. This is a biomechanical study that shows certainly that the suspensory fixation devices are acceptable, but some good work out of Chris Harner's group from Pittsburgh had shown that even when there is some subtle motion or cyclic displacement, that doesn't necessarily translate to increased clinical laxity or poor subjective outcomes. So our next step with this would be to be a prospective comparative study comparing suspensory adjustable fixation with interference screw fixation for BTB autografts.